Transthoracic echocardiogram. An echocardiogram, also known as an echo, is a simple non-invasive test used to assess the structure and function of the heart muscle and valves. It is a painless test that uses harmless, high-frequency sound waves called ultrasound to generate detailed pictures of the heart. The term transthoracic means across the chest. Sound waves are sent from a small probe coated with gel and placed on the chest. The sound waves bounce back from the heart muscle, the blood and the heart valves at differing rates, a similar principle to that used by bats, allowing them to fly so well in the dark. The returning sound waves are used to generate a picture of the heart beating. An echocardiogram does not use radiation and is a very safe and painless test. Most echo tests also use Doppler ultrasound to allow more detailed assessments of the heart valves. Doppler ultrasound measures the speed at which blood is travelling through the heart at various points, but in particular through the heart's valves. Special computer software can be used to assign colours to the different speeds, called colour flow Doppler. This allows for better viewing of the blood flow patterns, a more detailed assessment of leaking and narrowed valves. An echocardiogram can give important information regarding the way in which the heart muscle pumps, especially useful after heart attacks and in patients with heart failure. The size and thickness of the heart muscle and chambers. Leaking or narrowed valves in patients with heart murmurs. Blood clots, and very rarely tumours within the heart. Disease or fluid within the sac surrounding the heart, called the pericardium. Abnormal connections or shunts within the heart. A stress echocardiogram, performed during exercise or while the heart is made to work harder by the infusion of certain drugs, can be used to assess the pumping action of the heart muscle. It can also aid in the assessment of problems with the blood supply to the heart's muscle, called ischemia or coronary heart disease. It usually takes about 20 to 30 minutes for all of the images to be recorded. In a small proportion of patients, in particular those who have problems with their lungs or who are overweight, it is not possible to obtain pictures that are detailed enough to allow accurate assessment. In these situations, other investigations may be needed to clarify the diagnosis.